In this video, we're going to talk about how to differentiate the various causes of hip pain. We get questions all the time about this. We get people reaching out asking us if we can help them with their hip pain. But the first step for you or for us as a practitioner is to understand where is it coming from exactly so we can actually treat it properly. My name is Dr. Todd Pickman. I'm the clinic director of Gonstead Spine and Wellness here in Meridian, Idaho. Let's dive into it. Next, sacro-iliac. This is the joint between the pelvis and the sacrum. So I'm using my hand to illustrate this. So the pelvis is here, the sacrum's here. There's not really a whole lot of movement in a normal functioning SI joint. The studies show there's about 3 degrees of rotation. So it's not this big mobile flopping around joint. It should be a very stable joint, but that 3 degrees of movement is very important. The sacro-iliac joint can sprain. It can misalign from trauma, a fall on the pelvis, a fall skiing, snowboarding, car accidents, all kinds of things can jar the sacro-iliac joint, and it can take that 3 degrees of motion, lock up that SI joint, and now it doesn't move properly, and that can cause a lot of pain in that joint. And people oftentimes, when they say hip pain, really the origin is sacro-iliac joint pain. Now, in the Gonstead method of chiropractic, that's one of the key things that the Gonstead work does very precisely. We analyze exactly how the sacro-iliac joint is misaligned by x-ray analysis and by hands-on exam, and then we can specifically put a thrust into the pelvis to try to correct the mechanics of that problematic joint. There can be an SI joint subluxation. A subluxation is when a joint misaligns, loses its proper motion. Whether or not it's the ilium or the sacrum, on x-ray analysis, we use that to determine what is the best lever to fix that sacro-iliac joint. So I talked about the pelvis and the sacrum. The pelvis can shift, and that could be the best lever to make the correction. We need x-ray to figure that out. Or this could shift and misalign, and by putting contact with the hand as the chiropractor on the sacrum and using the sacrum as the lever to correct that sacro-iliac joint, there is a best mechanical way to do that according to the Gonstead system, and we discover that based on x-ray and hands-on exam. That leads me into this concept of sacral rotation. So in this diagram here, this is showing same thing, it's just a drawing, and you see the sacrum, that little triangular heart-shaped bone in the center, and you see there's a little arrow on both sides, and that's denoting that essentially it's evenly spaced from the center of the sacrum to the lateral border, same size on both sides. On x-ray review, when we put lines on the x-ray and we mark these things, we can determine if the sacrum has rotated based on how some of those measurements change. So that's one of the intricate things we look at with x-ray analysis in the Gonstead system. So sometimes we'll see patients, they say, oh, I've had x-rays before, but they've never had their pelvis analyzed this way, or parts of the anatomy are cut off on the x-ray, so you can't properly analyze it. So a full spine Gonstead x-ray has very specific markers that have to be identified, parts of the anatomy that have to be included, has to be shot a certain way to make it valid. The sacrum itself can rotate. And then another thing that can cause lower back pain, not necessarily hip pain out to the side, but I've seen patients that have a hip pain complaint, and the problem is actually a segment in the sacrum. So that triangular bone, which is thought to be a solid fused bone in most adults, well, in a certain percentage of the population, all those sacral segments that start as individual segments as a kid, and they typically start to grow and fuse together as an adult. In some cases, in adults, they're not fully fused. And so those sacral segments can misalign with trauma, a fall on the tailbone, traumas of many sorts that involve lower back types of lifting and shifting and severe lower back and hip pain. It could be from a sacral segment. That's probably one of the most common things we see when someone's been to multiple doctors, multiple chiropractors, and they just can't find a solution to their lower back pain. In a lot of those cases, they have a subluxated, a misaligned sacral segment, and that adjusts very differently than a spinal segment or the ilium or a rotated sacrum. So it's all very precise, but that's one of the things that makes the Gonstead method different. And so in this case, it's showing that that sacrum is rotated. So that rotation there with those arrows, you can see it's rotated. Okay, leg length and equality. This is another component that needs to be looked at. I can't tell you how many people we see that come in that have a hip problem or a low back problem, and we take an x-ray and we measure right across the femur heads to see if there's a difference in leg length. This x-ray up here, you can see it says a 5.8 millimeter drop on the right side. We're looking at this x-ray as if we're standing behind the patient. So right is on the right, left's on the left. And it's about a 6 millimeter drop if we round up. That's where it starts to become significant, because as that leg length difference changes, it drops, it changes how the sacrum or the tailbone sits, it changes how the spine compensates. And so it's a very important thing to understand. And the pelvis itself can slightly misalign, and that can sometimes contribute to that leg length difference. Or sometimes the pelvis is misaligned and it's compensating, meaning it's twisting and trying to reduce some of that short leg that the person has. Those are the patients oftentimes, they come in, they've seen a physical therapist, a chiropractor who's never taken x-rays or never analyzed it like this, and they've been told, oh, I lay on a table, they look at my leg length, they adjust me, and that changes my leg length. Well, some other variables that have to be considered there to find out if that's actually something that's going to last more than 5 seconds after you get off the table, and that's taking a weight-bearing standing full spine x-ray, looking to see how the pelvis is aligned, looking at what the leg length difference is, understanding those relationships to see, is the pelvis twisted because of the short leg, or is the pelvis twisted contributing to a short leg? In some of these cases, a lot of them, we have to put a lift inside of the person's shoe to help level their pelvis. This is a larger leg length inequality here. You see it's 13.4 millimeters. If you looked up higher in the spine, you'd see that the sacrum is dropped quite a bit on the right side as well, and then the spine would start to deviate off to the right side. And then this one's even bigger. This is almost a 21 millimeter short leg on the right side where it's really dropped. These are some extraordinary findings that are life-changing when we identify this for a patient, because no one's found this on them in the past. Sometimes we catch these in teenagers or someone in their 20s or 30s. No matter what age you are, you have the ability to jump in, improve the mechanics, and prevent the hips and the spine from breaking down prematurely had you have not caught this. There's also in the sacro-iliac joint, if there's repeated trauma or there's certain ligament laxity conditions that people can have with their ligaments all over their body, the SI joint can move excessively. And if that's the case, then we're looking at trying to stabilize musculature and make sure everything above and below that pelvic region is as functional as possible. So there's solutions to these things. There's things that we can try conservatively before someone has to go off and do something extreme like a surgery, for example. Okay, so there you have it. That is a breakdown of the different causes of hip pain. We covered almost everything out there. There's probably a couple others that I didn't cover, but if you have any sort of hip pain, or you know anyone that has hip pain, or if anything that you watched in these slides intrigues you as far as just wanting to get a full comprehensive spine workup, you can reach out to us. Our clinic's Gonstead Spine and Wellness. Our contact information will be below. And when it comes to the health of you and your family, results matter most. Thank you for watching. Make sure you subscribe, like, and comment. We appreciate you watching, and we'll see you on the next video. Video presentation by Meridian Gonstead Spine and Wellness of Meridian, Idaho. Our practice is dedicated to people suffering from neck pain, low back pain, tension headaches, migraine headaches, herniated discs, and leg pain such as sciatic. We have treatment protocols for musculoskeletal aches and pains, joint pain and dysfunction, and whiplash injury. Gonstead Spine Wellness offers a distinctive chiropractic experience. It is the only office in Idaho with digital motion x-ray technology. And this advanced imaging tool, combined with the Gonstead spinal analysis and necessary radiographs, enables precise identification of spinal issues. We provide safe and effective Gonstead adjustments, corrective care through chiropractic biophysics to enhance and sustain proper posture, and a 12-week transformation program. This program includes access to a comprehensive video exercise library for ongoing home support, ensuring long-term health and wellness. Call us at 208-888-6077, where results matter most.